In 1914, American women demanded the right to forget. German doctors said they had a solution: morphine and scopolamine. A woman would labor, scream, and thrash, and remember nothing. They called it Twilight Sleep. The women woke calm and asked if it had started yet. The baby was already in their arms. Doctors measured success by what patients could not recall. Silence meant safety. Forgetting meant freedom. The procedure spread because the metric was memory, not experience. Women's magazines celebrated it. Suffragettes demanded access. Mothers organized and called it liberation. What the women did not remember, the nurses did. Patients screamed for hours and clawed at restraints. They were blindfolded so light would not trigger panic. They were strapped into padded cribs so they would not hurt themselves. The drugs did not remove pain. They removed the memory of it. Some babies were born sedated. Some never breathed. But the mothers woke peaceful, and peaceful was the only metric that mattered. Memory returned slowly and unevenly. Years later, some women remembered fragments, not stories but sensations. One described waking from a nightmare she could never place. Her arms were pinned and her mouth was open. She was screaming, but no sound came out. She did not know why the dream felt familiar. Another remembered the smell of leather straps. Another remembered hands holding her down. Their bodies reacted before their minds could explain. Panic without context and fear without memory. One prominent advocate died during the procedure. Hospitals quietly revised and natural childbirth movements grew. The spell did not break from outrage. It broke from accumulation. The doctors were not cruel, and the women were not deceived. The body screamed and the mind forgot. Everyone agreed it was progress. We measured the wrong thing and called the silence a cure.